Hi, my name is Sydney Zografos, and I will be answering the question from Chapter 1 of why do speech pathologists and audiologists need to be trained in anatomy and physiology, and how does this help them provide the best care to their clients and their families. Speech pathologists and audiologists need to be trained in anatomy and physiology because they should have a knowledge of the whole person in order to properly diagnose and treat. When attempting to diagnose a patient, the speech pathologist should first look at the anatomy of the patient to make sure they have all the necessary tools in the toolbox. If they do not have the necessary anatomy, their diagnosis and continuation of treatment is greatly influenced. For example, if a child that is nonverbal comes to a speech pathologist for treatment, the first thing that should be checked on is his or her oral anatomy. Even though the child is said to be nonverbal, they may just not have the proper structures in order to communicate. This situation could completely change the course of treatment for this said child. They may even need to seek further medical intervention depending on the severity of the structures that may or may not be there. Another example would be if a person who recently has had a stroke and gets left with extremely weakened oral muscles. If this were the case, the speech pathologist would have to know the anatomy of the mouth and face to create a personalized treatment plan for this said patient. On the other hand, if the patient has a physiological condition, the treatment plan would again be geared towards the condition. In conclusion, it is essential for speech pathologists and audiologists to have a knowledge and understanding of anatomy and physiology so they can better understand, diagnose, connect with, and treat their patients. Thanks.
Hi, I'm Jordan, and bouncing off of what Sydney said, it is critical for speech-language pathologists and audiologists to have a strong understanding of anatomy and physiology. Anatomy, in simpler terms, is the structure of an organism, whereas physiology is more the function. In order to be able to function properly, you must have all the necessities to do so. Your treatment for patients without the proper structures is vastly different than the treatment you would provide for the patients who have all the necessary structures. Implementing a treatment course that involves therapy of a muscle that a patient doesn't have obviously wouldn't work. It would be similar to trying to brush your hair without a hairbrush. It makes tasks that are seemingly simple a lot harder when you don't have all the things you need to complete them. Hence why it's critical that speech-language pathologists and audiologists understand anatomy and physiology completely. For example, if you have a patient who's had a glossectomy or a removal of part of or all of their tongue, your treatment for that patient is going to be a lot different than it would be for a patient who has their entire tongue. It is also important to understand anatomy and physiology for the family's sake as well. You should know as much about the patient as the family does. And it's important to properly diagnose what is going on with the patient as well. If you don't understand the physiology of speech and hearing, then you won't be able to properly identify the problem. To sum it all up, anatomy and physiology is important because it helps us to properly treat and diagnose our patient.